last day to pick an insurance policy. That is the end of open enrollment across the country for 2024.
So this means now is the time to act to make sure you have an affordable health care option before you head into the new year.
Joining us today is Joel Laurie, the president and CEO of Laurie Life and Health, an expert on everything you need to know to make sure you're good to go by Friday. Joel, thank you so much for being here.
Thank you, ladies, for having me.
The importance of making sure that you are set before open enrollment closes is what and
well,
why?
You know, in South Carolina now, there are over 380,000 people that get coverage through healthcare.gov, through the marketplace. This was started when the Affordable Care Act passed many, many years ago. And we were just talking during the break. It's real important, first of all, for people, if they have coverage, to update their application. If they can do that directly, they can do that through the help of a company like ours. There's no service charge to do that. But many people get subsidies. About 90% of the people that have coverage through healthcare.gov give it a subsidy or a discount. That subsidy, Billie Jean, is tied to their income. So what we want to do is project your income for 2024, make sure you get the most amount of subsidy you're eligible for, but not too much, but not too little. We want to try to hit it closely, and that's why we recommend updating that application.
All right.
And is there a way for people to know if they qualify, or is that something where they might need some extra help?
Absolutely. Great question, Cynthia. And what we want them to do, call our office. Call Laurie Life and Health, call somebody in your local community that you deal with, somebody that works in this market. I believe that it's better to deal with a local expert on this than some out-of-state call center. They don't know you, they don't know your situation, and they can quickly take a look at your income, take a look at your household size, and then explain to you the many different options that are available. Many people, they get enough subsidy to offset their premium that they may qualify for what we call a zero premium plan. Right. So this is a plan that the consumer doesn't pay anything, again, because that subsidy is offsetting the premium. But those are great plans. They provide co-payments for doctor's visits. They provide prescription drug benefits. Most importantly, they provide a maximum out of pocket. You know, healthcare is one of the #1 reasons, healthcare debt, for bankruptcy in America, and particularly here in South Carolina. And to have protection so that, God forbid, somebody goes into the emergency room, we want to prevent them from walking out of there with a bill that will follow them around the rest of their life.
I'm so glad that you mentioned the $0 premium plan, because obviously with inflation, a lot of people, you know, may be in between jobs. That's something that can help them. And sometimes just navigating through all of those plans can be so confusing. And so I know that your office provides one-on-one help with that. How can people reach you?
Great. Thank you for asking. They can just call 803-256-2067 or Google our company, LaurieLifeandHealth.com. It really takes about 15 minutes on the phone. They're welcome to come in, but we can usually do this on the phone from beginning to end to find out what they qualify for, and then look at the different plans that are available to them. There is an extra thing I want to mention, though. In addition to the plan itself, we want to make sure that we find out if your doctors are in network, and the prescription drugs you take are on their list of covered drugs, which is called a formulary. And that's why it's really, you just don't want to immediately just sign up for a plan. You want somebody that's going to do that research, because once you sign up, you're pretty much, with the exception of some special circumstances, in that plan for the rest of the year. Enrollment deadline is midnight on Friday. So for coverage to start January the 1st, we need to talk to you by Friday at midnight. Even if you think you don't qualify, take 5 minutes and pick up the phone and call, because you would be surprised the number of people today we still help that never had coverage in the past, that we're still so thrilled to know that they qualify for a discount and they can get the coverage they need for them and their family.
And Joe, what about people who may be on Medicare and Medicaid? Is this something that they may possibly qualify for?
Good question. So if you're on Medicare, you really don't qualify for an Affordable Care Act plan, but you hit an important subject. You may remember I came on and spoke with y'all a couple of months ago about people that were coming off of Medicaid. Medicaid is doing a redetermination process. So a lot of people that got Medicaid during the pandemic, they were not required to requalify. That process has started back up. So in many cases, Billie Jean, when they come off of Medicaid, they may qualify for a $0 plan. That's why we want to talk to them to see if we can help them continue their coverage.
Good point.
Because that's one thing I was wondering. I mean, how often is it that people are calling and they didn't realize that they qualified for these discounts?
You know, we have many people in our office that are doing this, and I talk to them every day. And, you know, are you talking to existing clients, new clients? We still have people we're talking to every day that for the first time, and the Affordable Care Act has been out, you know, for almost 10 years now, maybe more. If I do the math, sure, it's been right at 10 years, that still finally took the time and to get, you know, they just were shocked to know that they qualify for a subsidy. They can get into a plan. Sometimes it's zero, sometimes it's a minimum premium. That premium through healthcare.gov is going to be tied to your household size and income. So it never hurts to call. And I can tell you, it's one of the blessings that we have in our industry when we can see people get coverage. Many of them have never had it, and they don't have to go to the emergency room now when they get sick.
Right.
And that's just a blessing to be able to help people like that.
Really great details, Joel. Thank you so much for coming on the show.
Thank you for having me. Appreciate
Again,
it.
Friday at midnight is the deadline for open enrollment for healthcare.gov, and share your information once again.
Just contact us at 803-256-2067, and we'll be glad to assist.
All right, you guys make sure that you get on it, especially with all of the illnesses and ailments going on out there. All right, when we return, much more on your news at 5:30 after the break.
Missed your last